So let's get started. Welcome to the Canadian International Council's panel on drug policy. It's been a really exciting week on drug policy and drug reform discussion worldwide, but also out of New York City. And we have a couple of great guests joining us. This panel discussion is the culmination of a whole week-long series that the CIC's been doing on their website, opencanada.org, looking at drug reform in Canada, in the Americas principally, but also around the world. So in New York this week, the Global Commission for Drug Policy released a pretty big report with some high-profile names who came out to mark the release of this report: Ban Ki-moon, Louise Arbour, many former presidents. It got a lot of attention around the world, thousands of articles in about 12 languages or more, according to the Commission. So a lot of momentum here, and we wanted to talk today about this momentum and how real it is and the challenges ahead, especially before a special session at the UN in 2016, and also just in different regions, the status of the dialogue there. So I really want to give a big thank you and welcome to our guests. In Toronto, we have Dan Werb. Dan is the co-founder of the International Center for Science and Drug Policy. Welcome, Dan.
Thank you. Thanks for having me.
In New York, we have Steve Rolls, who is a normally UK-based senior analyst with Transform Drug Policy Foundation. Welcome, Steve.
Hi there.
And in Aguascalientes, Mexico, we have Catalina Perez Correa. Welcome, Catalina. Catalina is with Mexico's CIDE Institute. Welcome, everyone.
Hi.
We also may have joining us at some point Jeff Ramsey, who is a journalist in Uruguay, and we'll definitely be talking about Uruguay. But before we do, I want to get a sense from all of you, Canada, globally, from you, Steve, and from Mexico, Catalina, on the status of the debate around drug reform in those areas. Why don't we start with you, Steve, and if you want to touch on what the report mentioned, anything that you think is going to make some waves in the dialogue on reform.
Sure. Well, the report, which people can go and read online, it's at the Global Commission website. It's basically a broad reform platform that covers 5 or 6 key recommendations. One is a broad reorientation from a justice paradigm to a public health paradigm. One is around access to essential medicines to try and confront the chilling effect of the war on drugs on access to pain control. One is around decriminalization of drug users. It makes a very clear call for that and describing that are associated with criminalization of use. One is around a refocusing of enforcement efforts concerning organized crime. They suggest that rather than trying to eradicate organized criminal activity, we should try and sort of manage it to reduce the harm that it causes, because eradication is impossible, but management to reduce harm may be possible by targeting the most violent elements of the market. And perhaps most significantly, or at least in terms of the attention that the report's having, is a clear call for a progressive phased move towards legalization and regulation of currently illegal drugs. Not necessarily all currently illegal drugs, but certainly beginning with cannabis and coca leaf and some novel psychoactive substances, but certainly leaving the door open for other drugs in the future. It's nothing particularly revolutionary from the perspective of the drug law reform movement, but it's a very I think coherent and clear statement of the reform case. I think what's most significant, as you've already mentioned, is the high-level names that are associated with it. So, you know, all these luminaries from the UN, including Kofi Annan, former heads of state, and a whole range, there's 22 of them in all, a whole range of public figures who have real weight and authority. So it's not just the content, which is very clearly stated, but it's also the provenance of it, the people who are backing it. And specifically, it's targeting the debate for the UN General Assembly special session in 2016. And as you've already mentioned, because of the names that are associated with it, It has had a significant media impact already. There have been thousands of media hits. And hopefully it will have a genuine impact in shaping the debate in the run-up to the UNGAS in 2016 and hopefully beyond that as well.
Well, it's my impression that there seems to be almost a dialogue around reform happening at two different levels, the global level, and then, of course, how does it trickle down that debate to the policy changes that are happening at a national or regional level. And Dan, we interviewed you for the series this week, and you were speaking about the challenges in Canada and whether or not global reforms, especially in the U.S., will have an impact on Canada and what it means for the dialogue, for a next-door neighbor. What can you tell us about the status of the debate here in Canada?
I think we're at a really, really interesting time in Canada. I mean, just a few years ago, when Stephen Harper was asked about the possibility of decriminalization of cannabis in Canada or regulation of cannabis, he stated that we couldn't regulate cannabis. He said, I don't want to say that the U.S. would close its borders on us, but, sort of intimating that there would be this massive economic shock from the U.S. if we attempted to legalize or regulate cannabis. And obviously, now the U.S. is a leader in cannabis regulation with the regulation systems that have been set up in Colorado and Washington State last year. And it has really changed the environment for drug policy reform. And there are people from all political stripes talking about the fact that we need to change things now in Canada. I mean, one of those people now is Stephen Harper himself, who more recently said, something along the lines of, it's clear that our drug policy approach is not working. And in the light of that, the Canadian Association of Chiefs of Police came out and said that they would prefer a system whereby people who were caught possessing and consuming small amounts of cannabis would be ticketed rather than, and fined rather than be sent to prison. And that proposal is apparently being considered by our Justice Minister, Peter MacKay. So, I think it's pretty incredible. I mean, it's these slow, incremental changes that we've seen with the current government, which has really been a pariah when it comes to evidence-based drug policy. And they've certainly done things that have set us off in the wrong direction. And here I should mention mandatory minimum sentencing for drug crimes and other similar programs that they've implemented. But that being said, I think that even among these staunch enforcement-based staunch supporters of enforcement-based drug policies, there is an appetite for drug policy reform.
Well, it's interesting because, and I want to go straight to Mexico, because I think one thing that is happening with the debate in Canada is that a lot of the framing of the drug issue is around regulation, harm reduction, but we don't hear as much as you hear in the U.S. of the links between the negative effects that prohibitive laws have had, especially in Mexico. And Catalina, I want to ask you, because there's been some questions around, great if marijuana gets decriminalized or legalized, but what about cocaine, and what about the real impact that it could have on drug trafficking organizations and violence, and could we actually see waves from legalization of marijuana?
Well, I just want to say first that Mexico, I think, is a really interesting case because we've seen the worst of the war on drugs from the U.S. Basically, one of the things that we've seen is that the U.S. has outsourced its war on drugs, and the effects have been mostly lived in Mexico. And this has also happened because of the way that Felipe Calderón, who was president from 2006 to 2012, decided to implement the enforcement of prohibition. And what we saw, and what the effects of this, this harder version of prohibition was a raise in homicides. During his government, we saw a raise in homicides in 186%. Kidnappings went up. All types of violent crimes went up. We saw corruption in many of the police institutions, as far as the fact that by the end of his government, the federal police, the Secretaría de Seguridad Pública, had to be shut down, and there was a new institution created because it was so corrupt and involved within the organized crime and drug trafficking trades. And we also saw that use did not go down. In fact, it went up. And this had to do with the fact that the whole effort of Mexico was to stop drugs getting into the U.S. And what happens when you start controlling drugs getting to the U.S. is that they remain within our borders. And, well, the effect of that is that the drugs stayed in Mexico, and so now we have greater percentages of drug users, which didn't used to be a problem, and it's beginning to be a problem in terms of how many young people are using drugs, but also because our institutions are still criminally prosecuting users. So we don't have a public health approach, but a criminal law approach for drug use still.
So how is that changing? I mean, there's been talk out of Mexico City for Mexico City alone to legalize marijuana as a start. But as I said, it kind of comes back to that question of whether legalization of marijuana, and this applies not only to Mexico, but on the whole, because, for instance, incarceration rates in the United States, and maybe, Steve, you could speak to that, whether or not you know, most of those are happening because of marijuana charges. Do we need to open it up? You mentioned the coca leaf, which has especially implications for the Andean states, Bolivia, Peru. But what kind of what else do we need to do? Do we see this as an open door for the legalization or decriminalization of further drugs down the road?
Who you just met to?
Well, I'll start with Catalina in terms of what's happening in Mexico.
Okay, so what we see is the last government, the effects of the drug policy of the last government were so disastrous that we've actually have started to see some efforts to reform and to change drug policy. One of the things that I think is convincing policymakers is the fact that about 70% of the people who are incarcerated for drugs in Mexico or drug crimes are related to cannabis or cocaine. And I mean, this in a country where we have so many homicides and so many kidnappings, extortions, bank robberies is just unacceptable for a lot of people. On the other hand, we still have very strong conservative groups that are taking this as a moral banner. So we have opposition from certain groups that are seeing this as some type of, well, I don't know, it's just a risky thing that liberals are doing to get drugs to kids. And so we are seeing some reforms in Mexico City, in the state of Jalisco is another place that we see some reforms. From the federal government, there's now a recognition that the drug policy and the drug war was a failure. And there's starting to be some propositions, but we haven't seen them yet on the floor of Congress, which is where we need to see them.
And Steve, what are your thoughts in terms of where we need to go next? Marijuana start? Is that a separate conversation completely from other drugs?
No, I don't think so. I think there's whether strategically that's exactly how we'd wish it or not. Cannabis is is going to be the lead issue. I mean, it already is. It's one of the lower risk drugs. So the political grouping, public use drug, and it's also because it's so easy to produce. It's the most impossible to police. So it's inevitably going to be leading the debate, and that's already happening. We've seen Washington and Colorado, we've seen Uruguay, we've seen the Netherlands since the 70s, and we've also seen in Spain, the social club. So cannabis reforms are proceeding apace, whether we like it or not, and we obviously do like it. I think it's very useful, and I think if those cannabis reforms can be shown to be successful, it certainly prepares the ground for the wider debate around potential regulation of other drugs. But some of that is also happening. I mean, obviously you've already mentioned the coca leaf reforms that have happened in Bolivia, which politically were very significant. Bolivia was the first country to withdraw from any of the UN conventions, and then reaccede with a reservation on effectively legalization regulation of coca leaf. And also in New Zealand, we've seen the emergence of a very carefully modeled regulation system for certain novel psychoactive drugs, which could potentially be a model for regulation of other drugs in the future. And because those particular novel psychoactive drugs aren't covered by the international conventions, New Zealand has been able to proceed with regulating those drugs. So we do have these regulation models for drugs other than cannabis that are beginning to emerge. So the debate, these are still sort of fairly small regional enterprises, but they are beginning to show how we can move forward, and they're preparing the ground, and they're creating political space, and they're also creating a body of knowledge and understanding. And as the data starts to come in from all these places, particularly if, as we hope, the data is positive, and I'm sure that it will be, there'll be some bumps in the road and there'll be some mistakes, but generally I think these are going to be positive experiences, and that will then inform. It will be a slow process. It will be a phased, I think, probably generational process of reform. But it's not just a theoretical discussion anymore. It's happening in reality, and it can't be ignored. And the momentum is only in one direction. And I think there's an inevitability now that the issue is more the detail of what those regulation models are going to be like, rather than should we have them or not, and how and when it proceeds, and how fast. So it's not a theoretical discussion anymore.
I want to turn to the process of reform in Uruguay, because we see a lot of emerging different kinds of scenarios around regulation coming out, and you mentioned some great ones there, Steve. But it's one thing to go from an acknowledgement that past laws or policies have not worked, and what are the options, but how do we get those approved, and how do we get the public behind it? And in Uruguay, we saw a really successful public information campaign that prominent Uruguayans got behind, and there were, TV spots and a lot of advertising. But you also had a really progressive president and a party that backed, and not only backed it, were some of the first supporters of the initiative. When they were framing it, they framed it largely, it seemed, out of a security measure, or to affect organized crime. And one challenge, I think, for Canada will be to how do we distinguish these kinds of policies from, say, the being pro-drugs or pro-pot. And I'm thinking specifically, we have Mark Emery, who has been nicknamed the Prince of Pot and has got a lot of media coverage, and he, will be, I'm sure, in the spotlight for our federal election next year. Dan, how do you address that and make it clear to the public that being pro-reform isn't pro-marijuana necessarily?
I mean, personally, I look at the evidence. In the United States, for 30 years or more, the government has been collecting data on youth trends and drug use under this massive national survey called Monitoring the Future. And what they've seen consistently for the past 30 or so years is that the vast majority, so around 80%, sometimes higher, of youth in high school report that they have greater access to marijuana than they do to alcohol and tobacco. And that's, I don't think it's by coincidence that alcohol and tobacco are both regulated and marijuana is prohibited. And now what that says to me, when you start looking at the drug trends, which show that the potency of marijuana is increasing, the price of marijuana is actually decreasing in North America over the past 20 or so years, it shows that the availability, the supply of the drug has absolutely overwhelmed our efforts to prohibit it. So what we have currently right now, people say that marijuana is prohibited, but I would argue that what we have is not a prohibited market. We have a massive, unregulated cannabis market. So when we talk about reform, when we talk about regulation, in my mind, it's actually a move to a more cautious and conservative approach, because what we want to do is get a handle on these markets. We don't want to have a cannabis market that is totally unregulated by government, that we know exists and is by some metrics larger than the markets for tobacco or other drugs. Similarly, I think the more dangerous a substance is, the more important it is that governments regulate it. So when you look at something like heroin, we know that there's an incredible risk of overdose and other harms like HIV transmission through the sharing of contaminated needles among people who inject heroin. Now, surely that calls for government, the governments should be interested in controlling such a market, and there are models that are made in Canada models for heroin prescription. Now, heroin prescription is a model, it's a regulatory model wherein people who are addicted to heroin are prescribed heroin and they inject it or consume it in under medical supervision, and it's been shown to be incredibly effective at stabilizing people and helping to manage their addictions. And obviously that's one regulatory scheme. It's going to be entirely different when we start looking at each and every separate drug. But I think the important thing is that prohibition is just one blunt instrument that we can use to try to reduce the harms of drugs, and it hasn't worked. Regulation, by contrast, is a very flexible and nimble tool that we can tailor to the particular challenges that each drug faces.
Mm-hmm. Catalina, in Mexico, I visited there last summer, and especially younger people that I spoke to, it was such a clear connection from drugs to the violent repercussions that have happened there. Has that then made, has that shaped the dialogue in terms of, young people especially, and their outlook on drugs? I mean, I met a lot of young Mexicans who wouldn't touch drugs because they knew, they had likely direct family members or friends who had been impacted. And how do you see the approach then on drugs there?
I think there's a clear connection in the public debate and public opinion between violence and drugs. And a lot of people ask me what you asked me at the beginning about, well, how would regulating marijuana, alleviate the situation of violence that is being lived in Mexico? And the truth is, we don't know how it's directly going to reduce the market of organized crime. But what we do know is that a lot of the resources of the criminal justice system are being used into combating marijuana. And so if we liberate those resources, we can use them for more pressing matters like dealing with kidnappings or organized crime that are not only kidnapping but extorting the population and doing other more violent crimes. And I think that's something that has to be said and that has to be recognized. And the other question is the current drug policy in this. The fact that it's been violence and drugs have been related in the way that they have has made the public think that every user is a risky person. And so this has not only affected the way that users are treated, there's a whole stigma with users of any type of drugs, but it's also made users not want to approach institutions because they're criminals. I mean, our law establishes them as criminals, and so this makes them afraid to come out and say, yes, I use this drug or I use another drug and I have a problem, or and so what the current policy is doing is pushing away people who would need help.
Just to kind of end this conversation, because we want to keep it for another maybe 5-10 minutes, and we've had some questions come up on social media that I think for instance, the regulation of harder drugs that I think we've already addressed. So I want to turn to the future of prohibition. And was it a piece in the Atlantic this week that talked about a war on the war on drugs? which I think is a bit defeatist because we're trying to change the dialogue from using this idea of war. But prohibition is far from over, and I'm thinking of China, Russia, other countries that are certainly not even having the same debates that are having, say, in the Americas. Is it still better, I guess, to have a variety of different national or regional reforms? And what do we think of the challenges that will be posed by new supporters of prohibition and the fact that the UN Global Convention has yet to be changed, and maybe we don't know what kind of changes will be happening in 2016. But Steve, how do you feel about the future of prohibitive laws?
Well, I mean, you're absolutely right. You know, it's all very well for us in Europe and Latin America and the US to say, look, everything's changing. The war on drugs is over. We've turned the corner and all this. And to a certain extent, that may be true in those regions. Tipping point has been reached in terms of the public high-level debate in those regions. But you're absolutely right. In Africa, in China, in Asia, in Islamic states, in large parts of the world, this debate isn't happening, and certainly not reform is happening. But some things are happening, where the harm reduction is a harm reduction philosophy is certainly percolating through a lot of those places. But it can often be very contradictory. So, you know, China now has quite extensive provision of harm reduction for injecting drug users. Yet at the same time, they also have hundreds of thousands of people in drug detention centres without, you know, any due process, and often in very abusive conditions. And in Iran, they have very sophisticated harm reduction provision, but they also execute 2 people a day on average for drug offences. So it's a very mixed picture in a lot of the world. Even if there's some progress on public health provision, there isn't really a debate, certainly in large parts of the world, on regulation or legalization. So it's a very mixed picture, but I think if you can take one thing away from it, it's that the consensus behind the kind of punitive paradigm, the consensus behind the war on drugs is now broken. And the global consensus is what has maintained this global framework as a sort of meaningful international legal instrument, and that consensus is no longer there. There are increasing numbers of countries that are dissenting from the whole punitive ethos of the drug conventions, and really those drug conventions are no longer fit for purpose. And if they don't adapt to at least allow some of the progressive countries to explore some of these other options, that system may well collapse, and it may be the threat of the global system actually collapsing in on itself or just becoming irrelevant and redundant. That may be enough ultimately, and this may be a few years away, but that may ultimately be enough to bring Russia and China and some of the more intransigent countries round to at least accept, even if they're not going to legalize or regulate drugs in their countries, they may at least accept the reality that other countries are going down that road, and the international system needs to be adapted to allow it. So it's going to move at different speeds in different countries, but the consensus is broken, and the momentum for change is now, I think, inevitable now. But it will take time, and particularly around the treaties, it's going to be fairly tortuous and glacial in terms of its pace. But there is now at least the direction of travel is clear and inevitable.
And Dan, if legalization is on the table next year, that's still up in the air of whether that could go through in the next year or two, or considering an election of possibly a new government. But what are the 3 initiatives or policies that you would like to see changed in Canada, if not legalization?
Well, I think, you know, there's so much evidence that mandatory minimum drug sentencing mandatory minimum sentencing for drug crimes has been an abject failure in the United States, and it has been one of the drivers of an incredible amount of social ills. And the fact that our government here in Canada adopted measures similar to those in the United States last year is really, really problematic. So that would be number 1. Number 2 would be the expansion, number 2 would be just the acceptance of harm reduction by our federal government. When the current federal government took office, one of their first acts was to remove harm reduction, which is an approach to reducing drugs that are drug harms that involves essentially meeting people where they're at, not requiring that people abstain from drugs before they're provided with services. And our current federal government removed that as one of our planks of our national drug strategy. So I would like to see that returned as one of the planks of our national drug strategy. And three, I think that given, there is this sense in Canada that we're very lax on marijuana, but still there are about 60,000 people who are arrested each year for marijuana-related crimes. The proportion of those who are arrested just for simple possession has actually increased in the past 15 or so years. So I would like to see some sort of regulatory system for cannabis put in place.
Thanks. And I want to give the last word to Catalina because I think part of the changing dialogue has been around not just looking within separate state borders, but seeing this as a regional and global issue. And what kind of message would you want to portray, especially I think in Canada there can be sometimes a disconnect because we don't have the direct border that the U.S. has to Mexico on the regional connections here and how this is a regional issue?
Well, I think an important message is one that we found with our last study of the collective in the study of drugs and law, El CED. We did a big study on users and state responses in 8 Latin American countries. And what we found is that even though all the states that we studied say that they have that consuming illegal drugs is not a crime, and that they have some type of health approach, what we see is that every single conduct around use is still a crime. So possession is always a crime in one way or another. Even in the countries that have thresholds, the thresholds are usually really low and unrealistic, and they don't really correspond with what the people who use these drugs, the practices that they have. And there's no way to acquire these substances without committing a crime and becoming a criminal. So I think a central message to this reform process has to be that if we're going to take seriously the idea of decriminalizing the use of these substances, we have to see everything that use involves. And that involves not only possession, but the acquiring of these substances and the information that users need in order to protect their health.
Great. Thank you so much to all three of you for joining us. I think it's been a great discussion, even though we've touched on a lot of different parts of the world, and we're going to see reform take a lot of different paths in those parts of the world. But if you do want to see more about drug reform, of course, there's a number of organizations working on policy and promoting dialogue there. But for the rest of our series, you can go to opencanada.org. But many thank you to all three of you in New York, Toronto, and Aguascalientes for joining us here today. And take care.
Thanks very much.
Thank you.